Excellencies, colleagues, welcome. My name is Brian Morales from the U.S. Department of State. I'm the branch chief for counter-narcotics, and it's a pleasure to be here with you today to discuss the issue of synthetic drugs and the global coalition. I'm going to share my screen and um, run through a few slides that will share what we are doing about this challenge. As you know, synthetic drugs are easier to produce than ever. The chemicals that produce them are very easy to find. They're very affordable. The return on investment is huge. $3,000 worth of chemicals can provide $3 million worth of profit, as we've seen in the case of fentanyl. And we see that anyone with an organic chemistry degree, basic chemistry understanding with instructions online can access these chemicals and turn a very large profit. They can be sold on the internet through social media or through the dark web. They can be shipped to the consumer right to their doorstep in packages with a small number of pills in the package. So it is a challenging us governments that are working on this issue from both a public health as well as from a law enforcement perspective. As a result, the Global Coalition came together in July 7th of 2023. Secretary Anthony Blinken with foreign ministers from other countries came together. In total, we had over 80 countries and 55 ministers that spoke at the Global Coalition launch. And that also included 12 international organizations that were in attendance and also gave remarks at the director level. And since that July 7th launch, in September of last year, we had the UN General Assembly where we had a side event that was organized, reaffirming commitments to the Global Coalition. Then at the UN Commission on Narcotic Drugs in March of 2024, which is our large annual drug meeting, we had once again authorities from around the world that came together to promote global response on synthetic drugs. And now we have September 2024, the UN General Assembly coming up, where we will have another side event. This time, the President of the United States, President Biden, and other heads of state will be there, and foreign ministers to reaffirm really what will be a sort of recurring challenge to the international community, a recurring need to work together on this issue. This will not be solved overnight, but actually take a dedicated and sustained effort from governments around the world. At the operational level, we initiated 3 working groups, one on the supply side, manufacturing and trafficking of synthetic drugs, one on the public health side, number 3, which is what the demand side usually is. And then the second around number 2, around detecting threats and emerging patterns. That's around data collection. So you can see within each of these working groups that there are sub-working groups, 7 of them in total. Manufacturing and trafficking have their own. Data collection, analysis, and trends is one. And then information sharing, interagency collaboration, and policy formulation is another. We have 3.1 on prevention, 3.2 on harm reduction, treatment, and recovery, and 3.3 on engaging people in the criminal justice system. And with those groups, we broke them out into West and East because there is no single time zone that works for global communication. So West and East, we established 2 working groups and initiated a process of Zoom meetings with simultaneous interpretation into 6 languages, and have now had 150 hours of meetings, beginning in October with framing the issue, and then moving on to sharing best practices and models where we can intervene, what the deliverables and commitments are from governments, some action planning and implementation, evaluation, how do we ensure sustainability, and the final coalition meetings in September of 2024. So it's been quite a journey to bring that global talent. And in this case, I must say that these are governments that are coming together to discuss how we see the issue, how we understand the issue, and what some of the recommendations and solutions are that we're proposing. And we have, for each of these working groups and sub-working groups in each of the regions, 2 co-chairs. And you see the flags there representing the nations that the co-chairs are from. Here you see all of the countries where we have participants from. 1,600 participants from 158 countries, and 15 international organizations are also participating in our meetings. You see the names of those international organizations on the screen there. We have a website, globalcoalition.us, where you can see all of the videos of all the recordings of the sessions that have taken place. We do not record the discussion phase, and there are some presentations we also have not posted. And it's not just about governments. We also have other sectors that are involved in the Global Coalition. The Vienna NGO Committee helped us organize the civil society organizations and organized a few events. We also had the International Society of Substance Use Professionals, or ISUP, that brought together a global workforce and helped also organize some Global Coalition meetings. The International Consortium of Universities for Drug Demand Reduction, or ICUDDR, helped organize regional discussions with universities around the world, and then they came up with their own recommendations from academia. Then we had also the private sector. And the private sector, we've done individual events with some of the industries, but this is the area that we are looking to expand greatly over the coming year. And so there are 7 industries that we're looking at: chemical, shipping, consignment, social media, e-commerce, banking, and artificial intelligence. I'd say that the achievements of the coalition for this year is that we harnessed the talent, the focus, the attention of the international community, built a list of partners, brought them together, and came up with 68 recommendations of where we can take action. That also then led to 120 international initiatives that were identified by the international organizations. And we're developing now a year 1 report that we began in July to help frame what the achievements have been over the past year. I like to think of it as we all came together and started building our vehicle, started building our car, but now we're in the stage where we have now the structure and the understanding of where we need to go. We now need to get into the vehicle and drive it. We need to get to our destination. So the next year, beginning in October, we'll focus on the full implementation phase of the coalition with our international government partners, civil society, the private sector, and others. And what we're looking to do is to carry out very specific, concrete activities and lines of effort that will yield outcomes. So we'll have concrete results at the end of next year. And I'll say that some of those will be intermediate outcomes that will take years to fulfill, but we will have some outcomes by next year. So what's left to accomplish is to operationalize. We need to have collective meetings. We're thinking of a donors conference to bring the international donor community together so we can coordinate what counter-narcotics programs support we are offering the international community. We need to bring together thought leaders to help forecast what the future directions are of these trafficking patterns that we are seeing today. We also need to convene by regions to make sure that regionally we're able to bring together different partners and reflect on what the drugs are of concern in those countries. And we need to focus on very concrete lines of action, as I was alluding to have measurable progress. What are these lines of action? Well, within public-private partnerships, we need to look at how we can engage each of the industries to make progress. We need to improve secure international communication and intelligence platforms so that we can then have joint operations together with partners from around the world. On data collection, we need to improve the ability of governments to collect data on synthetic drugs. That includes forensic and other testing capacity. We need to have stronger early warning systems as well. We need to be able to engage legislators, parliamentarians, to develop legislation around synthetic drugs. There's a lot of legislation that's missing. We need to strengthen the global workforce and train clinicians around the world, help credential them, and also work with accreditation of treatment programs around the world. And we need to expand availability and access of prevention, harm reduction, treatment, recovery, and ATI services around the world. We have a calendar with a few events, but of note, the Middle East Drug Dialogue coming up in mid-October. The African Union will convene a supply and demand reduction meeting of governments in October and December, respectively. And as I mentioned, we'll have donor and thought leaders conferences as well. That's all I wanted to cover in 10 minutes. I thank you all so much. If you have any questions or comments, syntheticscoalition@state.gov. I appreciate your support. I appreciate your partnership and look forward to continuing our intensified work on synthetic drugs over the year to come. Thank you so much.